So today we're talking about terrain-based medicine and of course hormones, because we have to talk about hormones. That's one of our favorite topics here because as Dr. Sharon Stills says, it's a juicy slice of the pie. It's a very important part. However, if we do not clean up our nervous system, deal with fascia, allow our lymph and bite to flow, etc., then we are going to be missing out on all the hormone magic. So just slapping hormones on without working on that first could create problems. So today I've got my new friend since I moved to Arizona and very intelligent doctor guest. I love talking to her, all things medicine. Dr. Sharon Stills. Welcome to Midlife Conversations. I'm so happy you're here.
Oh, thank you. I'm thrilled to be here. I love that you're my new friend and you moved to Arizona.
You know, I actually met Sharon or Dr. Stills right before I moved here. We were at a mutual friend's house in San Diego, and I was just talking to her, and she happened to mention she lives in Scottsdale. Little did I know I was moving to Scottsdale at that time. So as soon as I did, she was one of the first people I reached out to have lunch, and we've been friends ever since. But here's the thing about Dr. Sharon Stills. She is a naturopathic medical doctor, but she's got a very unique background. And one of the first things I wanted to ask her about is that she is well known for bioregulatory medicine. What does that even mean? Can you help us? It sounds fancy, but I want to know what it actually means.
It is fancy. So basically, bioregulatory medicine or European biological medicine is the type of holistic medicine that's practiced overseas in Germany and Switzerland and Austria and so forth. And when I was a naturopathic medical student a long time ago in the late 90s, I saw that there were some doctors that were like getting amazing results that no one else was getting. And I was like, what are they doing? And I found out that they were using a set of these isopathic remedies called the Sonam remedies. So I'm the kind of person who like sees something that's working and goes after it. And so I started learning about the Sonam remedies, and fast forward, I started working for the company that distributes the Sonam remedies. I started while I was still in naturopathic medical school, teaching all over the country, studying in Switzerland, working at the Paracelsus Clinic with
Mm-hmm.
Dr. Thomas Rao and learning from him. And so I got very involved in what is known as bioregulatory medicine. So what exactly is it? Because most of us listening know about functional medicine, right? We know about
Correct.
allopathic medicine, which is typical medicine that we go to the doctor, we get a pill. We know about functional medicine, which is a little different, right? We look for the root cause. We're checking for heavy metals, or we're looking at your gut microbiome. But bioregulatory medicine encompasses that, but so much more. Bioregulatory medicine is looking at you as an individual. So looking through a constitutional lens, because what works for me may not work for you or for you or for you, because we all have different constitutions. We all have different ways we excrete. We all have different ways we experience the world. We all have different ways that we can or cannot tolerate something. Bioregulatory medicine also looks at the body as a complete organism. So we're looking at regulation. How is the nervous system affecting the regulation of organs? And so when we look at regulation, we have to look at you entirely. So what type of restrictions do you have in your body? What type of blockages do you have? Do you have, and we look, I'm like the doctor who talks about dentistry more than most dentists. And so we're looking at your mouth, because about 70% of blockages occur in the mouth, whether it be periodontal disease, whether it be amalgam fillings, whether it be galvanic currents, whether it be root canals or cavitations, infections in the jawbone.
Mm-hmm.
And so we have to clear the blocks. I'm looking at scars on your body, and it can be the original scar, your belly
Mm-hmm.
button. It can be a scar from a cesarean section. It can be a scar from an accident you had. And those scars create a blockage in flow of your nervous system, how the cells repolarize. They create a blockage in your acupuncture meridians and so on and so forth. So we have to open up the scars. We have to make sure your system, your extracellular matrix, so that's another thing that's different
Mm-hmm.
about bioregulatory medicine. We're not just saying the cell in the mitochondria is the be all end all, because the cell in the mitochondria actually float in your extracellular matrix. It's the space within the cells. And that's truly where health begins and ends. That's where the mitochondria get messages from. And if your pH is off, if your lymph is constricted, if you have mineral deficiencies, if you have emotional issues. So bioregulatory
Mhm.
medicine also takes a big part of thinking about your emotions. And so we hear a lot about mind body medicine, but I don't just give it lip service. I really dig in because
Yes.
they have to be like running together parallel.
Uh,
So those are a handful of things.
yeah, no, that you just now, of course, I've got a gazillion questions on that. And I'm just going to kind of go down. So, you and I have a mutual friend, Dr. Sabrina Salt. And one of the first things that she told me when I met her and I had my explant is I had these deep scars from that. And she said, we need to address those scars or you are going to create a block. And I didn't understand that until you literally just said that. So that's one of the things that I'm going to be working on with her is getting rid of that tissue. So let's start with that. Let's talk about scars and what that creates in our body. I've not fully understood that. What does that mean? It creates blocks.
So scar therapy comes from neural therapy, which is another German technique. And what it's saying is that if you have a scar, so there's different ways it shows up. It can just show up locally, like yes, from having an explant, which woohoo,
Mhm.
amazing. Like, so happy you did that. But it can affect your lymphatic flow in your breast tissue, right? Because now you have a scar there. Now there's
Mhm.
not an open flow. Also, the other thing that gets stuck in scars is emotions. So,
Mm.
very common to inject someone's scars and see them cry or get angry or have an emotional release because a lot of times these scars are associated with a surgery or an accident or an incident. And so we have to think about the emotional component too. But these scars are they're blocking the free flow of information. And so I go in and I inject with procaine, and then I also add homeopathic
Wait, you inject with what did you call it?
procaine.
Procaine. And is that different? And what's the advantages of doing that versus injecting with PRP?
Well, procaine is an anesthetic. It's what they use in Germany, and it opens up, it resets the cellular membrane potential.
Okay.
And then I add to it different homeopathic remedies that are good for anti-inflammatory, for getting circulation going, for getting movement going. The way they discovered it, it was like for anyone who wants to nerd out, you can Google neurotherapy, you can read about the
Hmm.
Haneke brothers. They're the ones who discovered it. And it's like they discovered, like if you have a scar, say up here, it can be affecting through the nervous system, through acupuncture meridians, it can be affecting your knee. And so
Wow.
you can inject one place and have resolution in another place, which goes back to bioregulatory medicine, seeing you as a whole system. Not, the other thing that I
Hmm.
didn't mention is that we really delve into the bioenergetics, into energy, and not just, what organisms are missing and need to be repleted in your microbiome, which of course is important, but we're looking at light and sound and color. These are all things that I incorporate when working with
Mm.
patients because we heal on so many different
That makes
frequencies.
sense. Okay, I've got a lot of questions about that too. I'm adding it to my list. So I want to stay on the scars for a minute here because this is a big. So a lot of people say that they can help break up scar tissue for this reason, but they go about it in so many different ways. So how do we know that we're getting the right information? Like you just mentioned, you do it with this anesthetic and then homeopathic remedies. I've heard doctors say that they do it with PRP. I've heard people say they just do it with like a gua sha or fascia blasting. So how do we know? Does it all work? And is there pros and cons to those different methods?
Yeah, that's a great question. And so, I find sometimes like if you're not licensed to inject, then you go and look for other ways to do things. So, like you can use green, you can use neural stimulators to block, like you said, a fascia blaster. You can use other things and they can definitely contribute. But I'm like old school. I'm like neural therapy was done with procaine injections.
Hmm.
That's how I do it. That's how I see that I get the best results. So, I would recommend looking for someone in your area who does neural therapy. There are
Okay.
people who do it. And then, you can always work with someone else. I mean, I will muscle test. So you can, find a strong muscle and then touch your scars and see. And like 99% of the
Wow.
time, your muscle's going to go weak. So it's a good way for me to explain to patients, like, because it's hard to
Okay.
sometimes think like this little scar is
Yeah,
doing
that makes
it.
sense.
So, but it really is affecting your whole nervous system regulation.
So PRP would be spinning down your own blood and injection. Is that effective? I know that that's not what you do. Do you know why do some doctors lean towards that for breaking down scars?
Yeah, I mean, I'm PRP is not my thing because my son, who's also a doctor, that's his thing.
Okay.
The PRP to him. So I've honestly never heard of using PRP
Got
for
it.
therapy, but it would make sense because it's anti-inflammatory and so it's going to help break things down. And the truth of the matter is typically one treatment, it's not like you're just going to get one treatment and it's going to be a done deal.
Okay.
So you might want to experiment, find someone who does it with PRP, find someone who's going to work with color and your fascia, find someone who's going to do neural therapy and kind of see, because there's never just one
Right.
solution, right? It's always
Yeah.
multifactorial.
Well, that's something I'm about to venture into, is to breaking up those, because I do have pretty significant scars from the explant right over my chest. So I've thought, okay, it's time to address that. So I'll keep everyone posted on what I learned going down that journey for sure.
And
So
I just want to point out
mhm,
another important thing that I didn't bring up is tonsils. So that is a very common area because I do computerized regulation thermography, where I'm checking how the body is regulating, where I can see where scars are blocking things. And tonsils is a very common area that I see
really?
scars. And this could be if you had your tonsils removed and there's a scar from the removal from the surgery, or it could be that you still have your tonsils, but they're not functioning that well. Because we have to remember our tonsils are an expression of what's going on in our immune system in our gut. And
Wow.
so we could have issues with our tonsils. So I often go in and inject patients' tonsils, and it sounds
That
horrific.
sounds horrific. But
I like to be on the injecting end, not the
yeah.
receiving, but I've had it done and it's really not that bad. It feels like a pinch, but it can open up. Like if you are
Wow.
having sinus issues, if you have lymphatic issues, if you have swollen glands, if you're sick all the time, if you have digestive issues, opening up your tonsils can be a
Mm.
huge thing.
Okay, so while we're on the topic of, you mentioned that sometimes people can't inject, so they'll go down fascia. Let's talk about fascia for a minute, because there's a lot of controversy, surprisingly, over fascia. I didn't think there was so much controversy over it, but it turns out that there is. A lot of people doing fascia release techniques, using devices to break up scar tissue, cellulite. What are your thoughts? I know you're a fan of it, but what are your thoughts on the benefits of that? Why is there controversy over it, if you know? I don't even know if you know that there's controversy. Okay, there's controversy over everything, I feel like. And then what do we need to look for when we're doing fascia release techniques?
Now I'm curious. I'm like, how could there be controversy over
There's
fascia?
controversy over everything.
That is true. That is true.
Yeah,
Um,
the reason I say that is I had shared my friend Tamara Renee, who's amazing, who when I'm in San Diego, she does fascia blasting on me. And
mhm.
it's been great. It's like, it's great for skin, it's great for muscle tone. I like it. It doesn't feel good when you're doing it, but it feels good after. And I had shared a few times on social, and I had a lot of direct messages about, oh, there's lawsuits over fat. I had no idea. So and then it can make cellulite worse. I had never heard that.
No, I mean, so first of all, like your fascia is this really important structure that is covering every organ, every bone, every tendon, every ligament, everything in your body. And I think of it as like saran wrap. And so you know how like when you're taking out the
Hmm.
saran wrap and it's all nice
Yeah,
and straight and you're like, ooh, good. And then it gets all crinkled. And so that's like what your fascia does. It gets crinkled like that. And you have to open it up because if your fascia is crinkled, your lymphatic system is within the fascial system. Now that's not flowing. Your
makes sense.
lymphatic system is what's bringing the good stuff in, taking the garbage out, which is really funny because I hear the garbage being taken out outside the window. Like it's happening in real time. And so, why wouldn't you want to open this? Your fascia is responsible. It's really an energetic network. So it's like the terrain inside. It's monitoring what's going on outside. It's monitoring what's going on inside. It's changing. It's making differences. If you have pain, like there is always a fascial component to it. So
Mm,
it's just something that's not really, I mean, I think now like fascia and lymph is getting more attention than it ever has.
yeah.
I've been talking about this for like 23 years. So, but it's like, if you take nothing else, but you just take a different lens of how you look at your body, because I feel like we all are like, what's the magic pill? You're here, you prefer to be a vitamin, right? Or an herb, but still like, what's the magic pill? What's the food I should or shouldn't eat? What's the magic, push up I need to do or whatever? And like, we have to like take a step back because when we're in that, what's the, first of all, our nervous system is not regulated. We're in
Mhm.
an anxiety mode. We're not giving attention or honor to our body, to the innate wisdom in our body, what our body knows how to do if we just let it be. And
Yeah.
we're not looking at our system as a system. We're not saying, oh, what are these big systems? Have I cleared my scars? Because when you have scars, you can't have a free-flowing fascial system. You
Mm.
can't have a balanced terrain. When you have stuff going on in your mouth, you can't have health in the body. Like every tooth, there's so many different levels it happens on, but for first off, like every tooth is related to an acupuncture meridian. So your wisdom teeth, for example, are related to your heart and your small intestine. Your front teeth are related to your kidney and your bladder. Your upper molars, this is one that I see all the time. Your upper molars are related to your stomach meridian, and your stomach meridian passes right through your breasts. So we see a very high correlation of women who've had root canals in that breast tooth, and then they get breast cancer.
Mm.
We remove the root canal and clean it out. We do other things too, but we can get the breast cancer to reverse. And so I see this all the time because I run thermography scans on my patients, and we're testing, not just like a camera picture, we're actually measuring 130 points, and I can see the teeth. I can see where the teeth are not regulating. And not every time, but most times someone has a bladder infection, chronic infections or issues. And it's like there's something going on in those teeth, or they have breast issues and they have this, or they have lung issues or colon issues. So, I was taught this very young over in Switzerland. In Europe, actually, most of the clinics that I'm associated and work with, they have dentists right under the same
Wow.
roof. And so you go see the dentist. My teacher taught me, I want to make my job easy. Like they go see the
Yeah.
dentist first and get that handled. So when they come to me, they're already clear and I don't have to worry
That's so
about
good.
interfering. So I've kicked many a patient out of my office who are like, well, I can't afford to see the dentist in you. And I'm like, well, then go see the dentist, get that handled.
Wow. I want to talk about that for a minute because I went down a whole, in fact, I had a dentist on my show. It was not a biological dentist or holistic. I just wanted to have a really knowledgeable dentist on because I had a lot of questions about what we need to remove in our teeth. Most of the people listening to my show or watching this on YouTube, they're in midlife like us. So they grew up with getting amalgam fillings. We grew up thinking that root canals were the answer when you had a problem with your tooth. So I went down a whole process when I was cleaning up toxic load of where I removed all my amalgams. That just happened within the last year. But I do have one root canal. Now I have not removed it yet because it is not infected and it was done by an endodontist under x-ray and it was done the best that it could be done. So I was really weighing what are the pros and cons to going through the process of taking it out, which is not easy, by the way. It's a whole process to remove a root canal, let it heal, bone graft, put a ceramic implant in. It's a whole process. And I decided for me right now to leave it alone because I don't have an infection. I don't have problems, but I decided that every year I'd have a cone beam. I would really have a radiologist look at it, just really go deep on there. But help me with that understanding. And when is it okay to keep them like I just justified and maybe that's completely wrong? When do we always need to be removing them? Help us understand. Is there any instance when we should be considering a root canal with a problem tooth?
That's a lot of questions.
I know.
So
Sorry. It's a lot.
no, that's okay. That's okay. I want to make sure I answer them all. So first of all, if you are listening, because what you just described is a separate situation, but I would say if you are listening, there's never a reason to get a root canal. Go see a biological dentist and, you got to search because, there's different degrees. You can call yourself a biological dentist, but, your training and so forth can differ.
Yes.
But always pull the tooth, always get a zirconium implant, always work with someone, never, because a root canal is saving a dead tooth and the teeth are organs. And we would never, if we had a necrotic gallbladder, we don't save it, or an appendix, if it's too far gone, I'm not saying you should remove these organs, but we take it out. We never in medicine say we're going to keep the dead organ, but we do that with teeth. And then we fill them with typically toxic substances like gutta-percha.
Yeah.
And then we have these low-grade chronic infections because all these little canals the immune system can't get to them. It can't clean them out. And so it festers. So what tooth is your root canal on?
It's a molar.
Okay. So, if it's an upper molar, that's the first tooth I was just talking about. So it's different for everyone. Like I said I do the contact regulation thermography, so I would test it.
Okay.
Come over, we'll do thermography and see,
Okay.
like, is it regulating? Is it causing a problem? I would
Let's
also
do that, Sharon, and I'll share the journey about this because I really went through this with the root canal, like knowing I would not get one now. I do believe most people's are infected and are causing problems. Maybe it's just wishful thinking. I'm like, well, I don't have any issues. It's not infected. I saw a biological dentist that said it's totally fine right now just to watch it. So I've justified leaving it in.
I don't know who the dentist is and I don't want to get into it,
Yeah.
but a true biological dentist would never say a root canal is totally fine because, you know, and I totally hear you. I do. And we don't know, right? Like, is it going to cause a problem down the road? It certainly can. We don't know. Could it sit there forever? Are there
Yeah.
people who've had root canals? So you really have to take the bigger picture into
Yeah. Okay.
account and see.
So we're going to do the thermography and we'll test and decide. You do know this biological dentist. I'll share with you later, but you know her.
Yeah, I don't want to say, oh,
Yeah, I know. No, she didn't say that they're good, by the way. She just said, let's keep an eye on it. She understood the concerns with going in and taking it out. So there was not, she wasn't saying it's good, keep it. She just said okay, so there's that. So you believe everyone's root canal should come out pretty much.
Pretty much. And then, of course, you know, it's like as a physician, it's my job for patients to figure out like when is the right time to do that. Is that like the first thing we got to go after? Are there other things?
Mhm.
You know, we also have to be thinking about cavitations and getting CT cone beam scans and having someone who understands how to read them, look at them to make sure you don't have underlying infections and things going on. And
What's
then
a cavitation, speaking of which? Because I know you had that removed. Can you share what that is and why people need to understand what that is?
so cavitations are infections in your actual jawbone, and they most often often they're in the wisdom teeth because a lot of people have had their wisdom teeth removed, or where you've had another tooth pulled and they didn't pull the periodontal ligament, they didn't clean it out properly, and you don't get proper oxygenation and nutrients flow back in and you end up with an infection in the jawbone. And it can be again, like a root
Mm.
canal, this low, slow burn of stressing out your immune system. So now your immune system is derailed and has to go after these low grade infections, rather things that it should be going after that you're being approached with every day. And so they can cause anything from autoimmune disease to chronic infection to long haul to cancer to on and on they can contribute. So I look at these things. So I use the analogy of a backpack. And so I feel like everyone is born with a backpack.
Okay.
Some of us get teeny weeny little itty bitty backpacks. I got a little itty bitty backpack. What does that mean? It means I have a weaker constitution. It means I was very ill as a child growing up before I understood how to like naturally take care of myself. It meant if they mowed the lawn, that's it. I was done for the day because my backpack was so small that any insult that came into it would
Wow.
affect me and I would be symptomatic. Some of us who have like big, strong constitutions think like, you know, Aunt Mabel, who's 100 and rocking on the porch and smoking her cigarette and drinking her whiskey and like she's fine, right? She got this big, giant backpack. So EMFs can come at her, root canals can come at her, this can come at her. And she's like, yeah, whatever, give me
That
another cigarette.
explains some people, yes.
And so we have to think about, you know, our backpacks and what do we have under our control? What can we put in or take out of our backpack to make our toxic load, our chronic load less?
Okay. I like that answer because it's not because that's the example people always throw out. Well, my aunt or my husband or my this, they lived to blah, 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 blah. And they didn't have, so it makes sense, but it is the load of it over time. And we're all made up differently. So we want to give ourselves the advantage of not creating that toxic load.
Yeah. And it's like, you know, typically when you like something chronic sets in,
Mhm.
there's often an emotional event that has happened right then, a month
Yes.
before, 3 months before. I can't tell you how many women I see who are diagnosed with breast cancer. And it's after a betrayal, it's after a
Wow.
divorce, it's after a bad thing with their male boss or their brother, or, you know, so every cancer has an emotional cycle to it and things that are typically related to it. So breast cancer is often betrayal by a man, or it's not
Wow.
self care. It's not taking care of yourself, it's putting everyone else first.
Mm.
Lung cancer has a lot to do with letting go and grief and things of that nature. So you see someone who loses someone near and dear to them, and then all of a sudden they can't speak and they like lose their
Mm.
voice, and then they start coughing. And so we have these things weaving in and out on top of the Wi-Fi and the glyphosate and the mercury and all of these other things. It's not easy to be a human these days. We have to really be paying
Yeah.
attention.
So you mentioned bioenergetics, and I'm wondering if that is similar to like frequencies. And so I've had, and I don't know the actual real name for it, but those a scan, like a frequency scan where it scans your whole body and it can see if a frequency is off, and it will tell you like you have this issue going on in your pancreas or you have this issue there. And it's kind of like freakishly correct. Do you know what I'm talking about? Those scans. Do you believe in those? How does that actually work?
Yeah, I think everything has a frequency, everything has a signature to it. And those scans, again, it's kind of like muscle testing.
Hmm.
Can be very effective. It has to be the right scan in the hands of the right person who understands how to interpret it. But I rely on energetic scans as well as physical. I like to combine everything
Yeah.
because I think everything matters. And I always feel like when we talk about the mind body complex, we tend to like lean to one side. Like either we're like into the mind and we're like, I'm just going to affirmate away my disease process.
Right.
Or we're like really into the body and we're like, I'm just going to organic broccoli the heck out of it for fun. And so it really needs to be a marriage of the two because most illness, if not, I would say all illness, has components of each
Yeah.
driving it. Sometimes they're different weighted. Sometimes you do need to lean a little more heavy on the bioenergetic side of things. Sometimes you need to lean a little more on the physical side of things. But I have experiences with both types of patients who are weighing way more to the other, and it never results in complete healing because we are these physical bodies, right? We're these bioenergetic beings,
Totally.
physical vessel, and we have to address both. And so when I say bioenergetics, yeah, I mean using sound, using light, using frequencies. Something as easy like you can all just go Google on YouTube solfeggio frequencies for
Hmm.
528 for the heart or something like that. I also like in my personal practice, I like to use color puncture, which is another thing that I do from Germany.
Hmm.
And color puncture is using different colored crystals into different areas on the body. So some of these are acupuncture points, but some of these are just frequencies and mappings that the guy who created it, Peter Mandel, who's
Hmm.
this amazing 85-year-old in Germany that I've gotten to spend time with. And that I believe he just channeled some of this stuff because
Yeah.
it's so intense. But by using color, we are affecting biophotons, and biophotons are the bioenergetic communication in the body. So, to me, the biophoton communication is the foundation. It underlies the actual biochemical or physiological foundations. So, we can make big change. We can use, for instance, yellow to move the lymph, or green to
Wow.
fight against tumor development, or blue to calm things down, or red to speed things up. And we do it by bioenergetic communication in the body.
I love all this. And I think it drives me nuts that some people just completely dismiss all of this stuff as like, no, it's pseudoscience or it doesn't work. And my examples I always throw out to them are a couple things. Like one, if you were to close your eyes and just bite a lemon, like in
Mm-hmm.
your head, what
Mm-hmm.
happens? You start salivating, you have a whole body reaction just from imagining that. And then same thing with you play different music, it puts you in a different state. Like there's some music that will fire you up and get you ready to go work out. Some music makes you happy, some music that can make you sad, some music that can make you feel relaxed. Like that's another example. So all of this does work. And to me, when somebody just completely writes it off as like, no, I think they're just missing this whole side of healing and whole side of well-being and thriving.
Yeah, I usually say the things that you're resistant to are probably the things you need to run like open arm to. Like a lot of times, what we're not into is like the answer. Not always, but we just have to be willing to look at that. And the guy who developed color puncture worked with Fritz Popp, who, Nobel
Hmm.
Prize in like, so, if you want to look, it is scientific. It's like the oncologist. This is like one of my
Hmm.
pet peeves, but it's like the oncologists who say, don't take any supplements when you're doing chemo because they're going to all interfere. And like,
Mm.
all it takes is like a quick look in PubMed these days, and you can see there are a laundry list of supplements that actually enhance the effect of chemo. And I'm not saying I'm for chemo,
Right.
but I'm using this as an example, that make chemo work better, that protect the healthy cells from the chemo. So to me, I call that lazy medicine. Like
Yeah,
if you're not willing to look and do the work, I took an oath saying like, I'm going to do what's best for you and I'm going to keep learning because science, medicine, energy, it's a continuing unfolding field.
totally.
And so I would say when you're looking for someone on your team, for a doctor near you, like find someone who's open-minded.
Yeah.
Find someone who says, because it always blows my mind that like oncologists, like when my patients go, yeah, my chemo, I didn't do chemo or radiation. I just worked with this naturopathic doctor and my cancer's gone. That the oncologists don't go, can I have her number? Because when I see
Right.
a patient and they tell me something amazing, I'm like, can I have that doctor's number?
Yeah. Versus
I want to
dismissing
talk
it.
to them. I want to learn. I want to see what they're doing. But like most doctors don't do
We'll
that. They're
dismiss it.
stuck in their little pigeonhole.
That makes sense. Okay, I want to get into one of your favorite topics and mine too, as of late. I want to talk about hormones a minute and just your thought process on that and why all of this other stuff in place is so critical. Because I notice, especially with midlife women, this is like the go to conversation. Like they think that's the thing that fixes everything. And then people are very heated and divided between yes, hormone replacement or no, I shouldn't have hormone replacement. So let's open up that discussion.
Ugh, okay. Yeah, I've been practicing 23 years and I started practicing. I actually went to naturopathic medical school to be a pediatrician and ended up being a women's hormone specialist, naturopathic oncologist. So letting name
Yeah.
take you where it will. But I started practicing right about when Suzanne Summers came out with her whole book and her whole thing. And a
Mhm.
patient brought it into me and said, can I have what she's having? And I like snickered because I only knew Suzanne Summers as the dumb
Yeah.
blonde Three's Company. But I said, let me read the book. I have an open mind. And what I saw what she was doing, I was like, oh, she actually, this makes a ton of sense. But let's put it into the context of terrain-based medicine. Let's not just magic bullet and think we can just take hormones and that's it. Like, let's really use this menopausal time. Like, I'm always like, the word pause is in there. I write menopause with parentheses around the pause because I'm like, it's not just about pausing your menstrual cycle. It is about pausing and really embracing, like, okay, I'm in my 50s. I plan on living to 130, so I'm not really
Mhm.
midlife yet. I'm on my way. But, let's think about like, let's take a break. Let's have a little exhale and think about what's important to us, what's working, what's not working, what do we want to do, where do we want to go? Like, no one's going to do this for
Right.
you. You got to do it for yourself. Like, we shouldn't even expect anyone to do it for. That's our job as a human being to kind of be
Right.
introspective and take stock. And so when you're doing hormones, you have to think about like what kind of terrain is the body are the hormones going into. Like we need lymphatic flow to deliver progesterone. We need a balanced microbiome. We need an unrestricted fascial system. We need our bile to be flowing. That's where T4 to T3 conversion happens for thyroid hormone. We need to be, I'm not going to say we need to not be stressed because I really believe if we're not stressed, we're probably dead. Like it's not about getting rid of stress. It's about learning how to dance with stress. It's learning about how to be in a relationship with stress because stress comes in so many different shapes and
Mhm.
sizes these days. And so you're not going to get rid of it. But if you are not regulated, if you do not know how to sit and breathe or be at peace in your own silence, and you haven't really thought about like what's important, then taking hormones is just, it's a band-aid. And I do believe, so I really practice root cause medicine, right? I am
Mhm.
all about getting to the root cause. But when we get to menopause, the root cause of why we don't feel good is truly because we're out of hormones.
Yeah.
And a lot of people who say, oh, I don't want to take hormones, I want to do it naturally. I'm just going to take some black cohosh or some maca or
Mhm.
other herb or vitamin E. Like that's not the root cause. Your body's not all of a sudden deficient in an herb. Your body's
Right.
deficient in a hormone. And so giving back these hormones and there's lots of different viewpoints out there. So I like to give them in doses that are low but are going to have an effect. So too low is not okay because then you're not getting the beneficial effect. And too high is not okay because then you're stressing out your body and you're putting it into a compromised position. And so you really want to put hormones into a balanced body. If you handle all these other things, if you look at all the systems in your body, if you clean up your mouth, if you take care of your scars, then you're not going to need as much hormones as someone else who
Mhm.
has. And I haven't even talked about, obviously, like you've got the workout stuff handled, you've got to be moving your body. You've got to be sweating. You've got to be hydrating. You've got to be eating the right diet for you.
Totally.
And the right diet for you may change seasonally or by the
Mhm.
decades, but you got to be nourishing your body. You got to be doing all these things. You've got to be sleeping. And a lot of times you're not sleeping because your hormones are depleted.
So there's so many things I want to ask you about hormones. We've actually had a lot of podcast episodes just about the cancer debate with hormones, which by the way, all that's been debunked that it's not that hormone replacement does not cause cancer. But before I go further with my question, can you address the Suzanne Summers thing on some level? Because that's the DM I tend to get a lot. But Suzanne Summers died of breast cancer.
So, one, I was not Suzanne Summers' personal doctor. She did live a long time with, I mean, that book came out when I first started practicing
Right.
23 years ago. I don't know what she chose or chose not to do during COVID.
Hmm.
So that changes,
A lot.
we have a totally different medical playing field since COVID, since vaccines. Everything is different. Like the differential
Hmm.
diagnoses are different. Everything is different. It's just a reality. So I don't know what she chose to or not to do. I don't even know what she was doing because I know Suzanne Summers, I credit her with like opening me up to bioidentical hormone replacement and rest her soul. And she did a lot for the community. But she went through a lot of iterations. Like she went through the Wiley protocol where they like totally overdose you. And so
Totally.
I don't really know what she was or wasn't doing. I do know, I look to my practice. I've been doing this a long time with tens
Hmm.
of thousands of women. So, and I also work with a lot of patients who have cancer and dealing with a cancer diagnosis. And so I know that I use bioidentical hormones to not only prevent recurrence or prevent it from occurring, but to treat active cancer
Yeah.
because estrogen is just a word. And then there's all these different types of estrogen. And there are certain estrogen metabolites like 2-methoxyestradiol, which does not get enough airtime. No one talks about it, but this is actually an anti-cancer molecule. They're
Hmm.
trying to patent it as a drug. They use it over in Europe, and I use it with patients. You can actually get it compounded. So we have to really understand what's happening. We know that progesterone is anti-cancer,
Hmm.
testosterone, DHEA. So the whole mishmash of a story, and it blows my mind that like doctors still, I can't tell you how many patients I
Mm-mm.
come in who see doctors and I'm like, they're living in like the
Yeah.
dark ages that haven't caught up to the.
Totally. They have, that's what I always say. If someone tells me that their doctor said that, I'm like, find another doctor because they're just not up to date on the research. They're just not even
Yeah.
staying open-minded. So assuming that we're on board with estrogen and we're on board with hormone replacement, there is a very different of opinion with even guests I've had on the show, which I then get confused too. So this is why I want to get your perspective on this about the amounts that make optimal for a menopausal woman or even perimenopause. Like I've had guests on that say we need to be doing 2 patches and have it our level, because the highest you can get an estrogen and a estradiol patch is the 1.0. So they put 2 patches on to 2.0 because they want their estrogen at extra high levels. And then I've got people saying, no, you just want enough to reduce symptoms like hot flashes. Help us. What's your thoughts here? It gets very confusing.
So I rely a lot on 24-hour urine testing
Mhm.
because that is the most accurate way to see your diurnal rhythm, what's going on with your hormones. And it can't be dried urine. It can't be just 4 samples. It has to be a whole day of 24-hour urine. I'm looking at my little orange jug over there that I get to,
Mhm.
you have to collect all your urine. That is the gold standard way to look at how your hormones are
So that's
metabolized.
not a Dutch test. This is something else.
It's not a Dutch test, no. It's, a 24-hour hormone
Yep.
urine test, but not a Dutch test. And so, what is the best level? It really depends. Like, I have some women, because, we think of a bell curve. So, I have some patients, they need like 5 milligrams of estrogen to like
Mhm.
hit their levels, to feel good, to have the bone loss stop to all the things.
Sure.
I have other patients who can do it on 0.625 milligrams. Like I have like
Yeah, it's all over the place.
some really sensitive patients. The average, I would say, is anywhere from 1.25 to 2.5 milligrams.
Okay.
And
Is that a patch number? Like, is that the average
I'm
patch number?
using transdermal creams. I'm using
Okay.
biased. I'm applying it to the external labia, so not to the vagina, but to the moist tissue. Your hormones, so a lot of people will have you put it here on your breast.
Hmm.
Has to go on the moist mucosal tissue. So it's either external labia or anus. So external labia is better.
Hmm.
But that's where we can, so because we get such good absorption there and we don't get dermal fatigue, which is what happens through the skin, often I can use lower doses and get just as much of a reaction. But I'm really looking to see, like, yes, we want to have symptom reduction, but the most important, I mean, symptom reduction is important, right? No one wants to feel like crap,
Yeah.
but we really want to get protection, right? We want to protect our hearts and our brains and our bones and our genitourinary system and our immune system and our lungs and our digestive system. And, we want the good stuff. We want the hair and the skin and the
Right.
nails and the weight. Like there's nothing that hormones don't affect. And so we tend to think that hormones, sex hormones, are because we have hot flashes or we have no libido. But
Right.
they're intimately involved in so many disease processes or health processes in our body. And so we don't just want to take enough to get rid of a hot flash. We want to do that, but then we want to check and make sure it's also giving us protection.
Got it. But you're also at the same time saying we're not trying to restore you to the age of a 30-year-old's hormone levels. You're just trying to get it so you don't have the symptoms and then you have optimal health outcomes for you.
Yeah, why would you want to be 30? Like, shoot me, please.
Okay, so you brought up another question though in what you said about the bias. So I actually was on bias and it was not helping me with my hot flashes at all, nothing. And I just went down a whole rabbit hole on why bias was not amazing. A lot of doctors speak out about that. And I'm on a 0.05 patch and I love it. I'm very happy with that and my levels right now. What is the controversy around bias? Why do some doctors love it like you do and some people hate it? What's the deal?
Well, I think some people who are MDs and don't understand the body as a whole are pinpointed. And what I would say, because I have patients come in who are on the patch and I 24-hour urine test them. And if they are metabolizing properly and they're not overdosed on, estrone, they don't have high estrone and their estradiol's in place and they have some estriol because estriol is super important. It's anti-inflammatory. You have to think of the receptor
Mhm.
sites, right? So estradiol hits both the alpha and the beta. So it's like stop, go, stop, go, stop, go.
Mhm.
And estriol is like stop, stop
Mhm.
inflammation, stop proliferation. Estriol does have benefits, just like estradiol. It's weaker, but it still protects the brain, it still protects the bones, still protects the urinary tract, and so on and so forth, still can handle symptoms.
Mhm.
So there is old data, old years ago now, but showing that women who have higher estriol levels, they don't get breast cancer. And if they do, they have a regression quicker. And so I have women come in and they come in sometimes on patches.
Mhm.
And often I find that I need to either add some estriol to the patch or I take them off the patch or their testosterone or DHEA or cortisol, something else isn't, it's like has nothing to do with the estrogen. I have seen some women recently actually on patches and I was like, you know what? I'm a big fan of if it's not broke, don't fix it. You
Mhm.
feel good. I'm looking at your results. Your results look good. We'll check you in a year.
Right.
So it's very individualized.
Okay.
I've used creams. I've never used patches for 23 years. I've never met a hot flash I couldn't tame.
Mhm.
I am,
I was
maybe
getting 5 an hour, Sharon. So I'm
yeah,
over
no,
it.
I'm
So for
happy
me,
you're
the
feeling
patch is
good.
amazing.
I have patients that have been with me over 20 years now, that I follow and so, because I started treating menopausal women when I was in my
Yeah.
early 30s and, now I'm one. But I just watch these women, they're like having sex, they're feeling great, they have no pain, they're sharp. And So, you find what works for you and you do it. I just think it's really important to remember to take it all in context, to make sure your metabolites are being looked at,
Hmm.
because it's a really important piece, to make sure your testosterone is optimized. A lot of doctors still think testosterone
Yes.
is not for women, to make sure your progesterone. So I do, just trying to throw out some good pearls for y'all. Like, I do progesterone in cream and capsule. I split the dose. I learned this a
Okay.
long time ago because they have different mechanisms of action in the body. So the capsule really crosses the blood-brain barrier and it metabolizes down to allopregnanolone, which
Hmm.
then hits the GABA receptors. GABA is your major neuroinhibitory transmitter. And so it's like chill pill, right?
Yeah.
Progesterone is forget diamonds, progesterone is a girl's best friend. And so when I used to have patients, I would say, are you having trouble sleeping or are you anxious? And if they said yes, they got capsule. And if they said no, they got cream. But then when I started watching my labs, I started realizing it wasn't enough one or the other. And that the cream is really what helps the body, what stimulates the osteoblast and helps the bone, what takes care of the breast tissue,
Mm,
on the blood sugar. So for years and years now, I split the dose. And if you are having trouble sleeping, like don't be afraid to titrate up your progesterone, because 100 milligrams is a standard dose. But I have some women's, again,
totally.
bioindividuality. Women need to hit 400 milligrams till they're sleeping. Some women hit 400 milligrams, and if that's not working, it's like, okay, well, then there's other reasons why you're not sleeping. But I believe,
Hmm.
the hormones, when they're dropping, when we give the body hormones, often like everything just gets better.
Totally.
You
So
know,
what I want to say, because I already know the questions I'm going to get from this episode, it's the same questions I get anytime I have anything on hormones. It's a couple things. One, people ask me, what am I personally doing? And I don't mind sharing it, but I just want to really say that what I'm doing has nothing to do with what you listening does, because we're all unique, we're all individual, and my levels, like my doctors base my levels on what my results show, and then we bring them up. And then same with you listening, like everyone is different. So like yes, I'm on a 0.05 patch based on my level. My estrogen was a 20. That's why we went on that. So my estradiol was a 20. I'm on 200 milligrams of progesterone because of that's what's working for me. So every one of us has to be on what is meant for us. My other thought I want to throw out there is that, and we're going to let you know how you can work with Dr. Sharon Stills, and learn more, but you've got to find a doctor that works well with you, that you resonate with. Like if what she's saying resonates with you, she might be the doctor for you. If what she's saying is triggering you and you're like, no, then she's maybe not the doctor for you. So there's not a one size fits all there either. I personally have three doctors. Literally work with three doctors, and that's the way that I like to do it. And they all have different information sometimes. And I go with what feels right to me. So we also have to use our own knowledge and just go, what does that feel right to me? Does something feel off about that? And I think we have to be our own health advocates and researchers. That being said, how can people work with you? Because I know you can work with people all over the place, right? They don't have to just be in Arizona where you are. Or
yeah,
how does that work?
I'm opening a big clinic in Arizona, as you know. We're excited about
Yes,
that. But yeah, I have patients that work with me from all over the place. They do fly in to establish care with me, and then, we can work
that's
anywhere.
great.
But yeah, I love helping women at this point in time because I feel like, we get gaslit a lot in medicine. Like,
Yes, we
we do
do.
a whole episode with you on like the major things we're gaslit.
We know. We've had some dinner discussions about it, but dang, we really do.
So, but I just see women's health turn around when they are told the truth. And I totally agree with what you said. Like, find someone that resonates with you
Hmm.
and that it feels like this is a fit. It's like finding a relationship, right?
Yeah.
It's a relationship. But I have seen women who struggle and suffer for years, and like it's never too late, right? That's a misnomer out there. Like if you miss the first 10 years, too bad.
Yeah.
No, that's not true. And like so many things that you're experiencing that you might not think have to do with hormones could definitely have to do with hormones, whether
Yes,
it's
absolutely.
eyesight or, I mean, it just laundry
Oh, I
list.
have a whole long list
Yeah.
like that, like just cleared up like that. So
Yeah,
yeah.
laundry list. So like don't
Yeah,
discount, don't let anyone discount. Know your intuition. Know if you feel like it's a hormone issue, like find someone who's going to listen to you.
totally. Great
So
advice.
important.
How can
Um,
they find you? Where do they go if they want to like even find out about working with you?
so drstills.com is my website. I have a big email list, so if you want to like keep up with me and find out what we're up to,
Amazing.
in my email list. And I'm trying to be better on social media. You're like my inspiration. I'm like I'm very inconsistent. So
that's okay. You're busy treating patients. We get it. Thank you so much. By the way, we recorded this podcast live for my 365 membership, which means if you ever want to be on while we do a live podcast recording, which means you get to hear this way before it releases ever on YouTube or out there on the podcast world. If you want to be on and be able to stay on after and ask questions, we stop recording questions for everybody. We record them for the group. You're welcome to do that. It's midlifeconversations.com/live. So midlifeconversations.com/live. That'll take you to how you can join in on the live conversation. If you liked this episode and you want to make sure you get notified of future episodes, if you're watching this on YouTube, make sure you hit that subscribe button so you don't miss any future episodes. If you're listening to this on podcasts, make sure you're clicking follow or subscribe so you always hear the new shows releasing. We do about 2 shows a week now. So thank you so much, Dr. Sharon Stills. We're so happy to have you.
Thank you for letting me come.